Greetings, everyone. My name is Brian Hurdle. I am currently a clinical pharmacist or ambulatory care pharmacist with the University of Maryland Medical Center Midtown campus. And I'm here to conduct a research seminar series, the first part. This one is research abstract writing and the submission workshop. So my intention is to help those along, especially the students or the young practitioners that have limited experience or no experience in putting a poster presentation together, and applying to an organization through the abstract process and actually standing up there and presenting their research findings. One of my major goals is to just give people a leg up, and hopefully provide some tips that some may not already know. A little bit about myself. I am a graduate of the Howard University College of Pharmacy. With my PharmD, I got my undergraduate degree in neuroscience from the University of Pittsburgh and my master's of public health from Drexel University in Philadelphia, Pennsylvania. I completed a PGY1 residency with Johns Hopkins Care at Home, outpatient pharmacy, and now I am a clinical pharmacist in ambulatory care services, as I mentioned before, with the University of Maryland Medical Center, Midtown campus. And if those of you are familiar, that is in Baltimore, Maryland. So tonight, my objectives. I want to just get the insight and help those to present a poster presentation at a professional organization. NPhA or NAFA is one of the biggest organizations that support underrepresented pharmacy students and pharmacists. So I feel that this is a good platform for those who may be, kind of nervous about doing it. It's a professional organization, so we are very much organized, and we want those students or young practitioners to be able to stand up on their license and practice, and be equal with their peers. And this is a great way to do it. So that is part of the encouragement, my whole objectives. And also, I find research post presentation may seem nerdy. I find it, fun and interesting. You can have a lot of fun with it. Depending on the topic, you can cater it to just about anything you want to cater it to, and also be able to present and then get a lot of feedback from the pharmacy community. So your peers that are in your organization, or your peers across the country, and even across the world. Like someone mentioned before, you might have heard that the degrees of separation for a pharmacy world is 3 to 5 instead of 6, like it is in other places. So in order to carry out my objectives tonight, I'm going to discuss the abstract process. We're going to review how to prepare the poster, some good design tips, and we're going to look at some good posters and some not so good posters, and then have a quick discussion on what to do for presentation day. So when you're actually standing up there with your poster in front of an audience or a crowd that is walking by evaluating your research. So before we get started, I do have a question, and you can put the answers in the chat, please. Standing 5 feet away from a poster, what is the smallest font size that would be the easiest to read? Would it be a 16-point font, an 18-point font, 20-point font, 24-point font, or 28-point font? So it's type in the chat if it's the A, B, C, D, or E. Okay, Janai, that's a good guess. D, yeah, definitely. Anybody else, please? I do like the participation. If people could speak up, that'd be great too. Okay, is it Yara? Okay, we have two C's and a D. Okay. So I will actually answer that question in the presentation, and you'll see why in a few moments. So I'm not trying to keep you all in the dark, but those are very, very good choices. Okay, why is the poster important? You've worked hard on some research. This is one of the best ways to communicate that research effectively. You'll be able to engage one on one with the audience and also network. Unlike Stand-up presentations where you have a platform, you're speaking directly to someone who is interested in what you're doing right away. You would have your speech, you have your time, and then you'll be able to just talk to them one on one. They can answer questions, and you just have a dialogue about what you're doing. Like slightly different than any of us or any of you that have presentations at large seminars where you would speak for 20 minutes or half an hour if you've done any type of rounds. You're speaking for a half an hour and then answering questions. This is a rapid fire one-on-one session. Some people are way more engaged than others, and they show it by asking those particular questions, which is good. The biggest benefits, you get immediate feedback on your work. You get to answer questions that may be asked, or answer questions that you might not even thought of, and that's very, very good. So it's that rapid succession and rapid firing back and forth that makes it very, very helpful to grow as a practitioner, grow as a research, and grow as a clinician. You also have that visibility in your field. Oftentimes, you never really know the person whom you're speaking with. They could be a future manager one day or a future colleague, or they could be a future collaborator. They might be so interested in your work, they might want to work with you and help you expand what you're doing. So it's very, very vital that you put a very good poster together and be able to deliver the content that's in that poster. So let's go over the abstract process. Typically, that's how you get to where you want to go as far as the organization and then presenting the poster at the end of the day. Generally, the abstract, it makes a lot of sense. That should be written clearly and concisely. If you are reviewing this or sending this in for review, that means a group of fellow pharmacists who've been practicing for some time are actually going to be reviewing this particular abstract. So it helps that you have a clear and concise abstract. Write everything clearly that describes your research. You don't want to have anyone try to guess on what you're trying to say as far as your research is concerned. Your method and your approach should be appropriate to what you're actually doing. So don't, make up any type of statistical tests that don't explain the results or don't, quickly lead to your results. Don't make up things. Make sure that what you're doing is actually applicable to the results that you are also presenting. Your evaluation and your analysis should be appropriately applied and interpreted. Again, don't make up any interpretations because the people who are reviewing these particular things are very particular and they are very knowledgeable. So there are people out there who have been practicing research for a very, very long time, and they can pretty much sniff out a bad abstract very easily. Your conclusions should state that there are strengths and weaknesses of your work highlighted. Every bit of research has pluses and minuses, things that went well or things that didn't go well. And it takes a lot of insight to point those things out. If things didn't go your way, it's always nice to have a small blurb down there or things that you would like to change for the next time you do the research. This also leaves the opportunity for someone who is looking at it to maybe say, hey, I would like to work with you on your research. I have some ideas. Maybe we can work together. It could be someone from a drug company. There could be a lot of money behind it. You never know. So it's always best to keep things honest and keep things open. So your abstract structure, almost every single organization will have the same setup. You'll have a title, your background, aims, and purpose, and/or purpose. For background, aims, and purpose, it might be a combination of both or one of the three. You're going to have a methods or methodology section, show your results, and conclusion or discussion. Now, as far as the results are concerned, some organizations will allow you to put results are pending. Because if you're still in the middle of your research or you're very, very close to coming up with your finalized results, then you can say that the full results of this work is pending. But the expectation is that you have something to show if your abstract is accepted by the time your poster is being presented at the conference or the organizational meeting. And then conclusion and discussion or discussion. This is where I mentioned before you wrap things up with a nice little bow. You talk about one or two lines about some of the pluses and minuses, strengths and weaknesses of your research, and or things that you might have wanted to do better or differently. So as far as the submission process is concerned, NPhA, just like all the other organizations, NPhA, SHP, ACCP, etc., they will have an online portal for your abstract submission. Some organizations, NPhA is no exception, does allow for an electronic upload of an electronic document. So it'll be a .x or .pdf file. Now, the thing about that is that you have to follow some very, very strict guidelines on how to format that particular document. There are also organizations where each section of the abstract will be a text box in the web portal. So if you have your abstract that's already in a Word document, you might just have to cut and paste certain sections of that abstract and put it into this web portal. If I'm not mistaken, ASHP and APHA is organized in that fashion. They have a whole separate um, portal that does those things, and then you would also upload your Word document if it asks for it. Typically, your abstract is going to be somewhere between 250 to 300 words in total, but make sure you pay attention to the submission instructions. The NPhA, I have a blurb of the instructions here. So we want to get everybody, as much as we can, encouraged and come out to present at our national annual convention from August 1st to the 25th in Cincinnati, Ohio. So the instructions and the guidelines are on the NPhA website where you can read the full things. But we need to have the presenting author to be a member of either SNAFA or NPhA in order to register and attend to the conference. We need an abstract submission form from the author in order to be able to accept the poster for a presentation. We have an electronic submission portal. It is a Google Doc that is already online. And I'll tell you right now, and I'll remind you all later that the submission portal will close on May 1st of 2025. So that's when the abstract portal closes. Make sure that you pay attention to the submission instructions that we have up there, because it's extremely vital for our organization and other organizations. But before we move on to the next part, I'm going to tell you a little story about why it's important to follow instructions. There once was a student pharmacist who had graduated from college, from pharmacy school, excuse me, started their PGY run residency, and they had to apply as part of their residency requirements, apply and present their poster for their research that they're doing, the longitudinal research project at APHA's annual meeting. Now, this pharmacist received a feedback from the reviewing body that's at APHA with instructions on how to resubmit the information for the abstract. Now, this particular abstract resubmission said that you would keep everything the same, except your changes would have to be in bold and italicized letters in the same portal in which you had the other, your original abstract. Now, this student pharmacist did not see that information or did not pay attention to that information, and their poster, no matter how good their research was not accepted because they did not follow instructions. Now, it was really, sad to hear about that information, but the rules are the rules, and some organizations take it extremely seriously, and they don't give you any leeway. So it's very, very vital that you pay close attention to those instructions. Now, I can't say that the person in the story, the pharmacist in the story, may or may not be me. I'll let you come up with that determination on your own. So now this is how we get into some of the fun things: preparing your poster, designing your poster. This is the fun part, but there's some do's and some don'ts. I would say some things that you should do: avoid clutter and unnecessary details. If it's extraneous, if it seems like it's too much, it just might be. Oftentimes, less is more. Using catchy visuals, graphs, charts, and images, they make your data a little bit more engaging and more appealing. So if you're able to express some of your results in table or in chart or graph format, I would say do so. Make it large. Oftentimes, you can put it as a centerpiece on your poster, and people will be drawn to it just because it is a figure. You want to use illegible fonts. Ensure that the text is readable from a distance. I will go into some of the font sizes in a little bit, but that's one of the reasons why I asked the question in the beginning. Um, Two of the biggest things that a lot of people may forget to do or might run out of time doing is proofreading. Check for spelling and grammar mistakes. There are people who are very particular about it, and when they view your posters, you don't want to have a comment saying that you misspelled too many words, or you've had so many grammatical errors that it's hard for them to understand what you're trying to say in your poster. Again, a lot of people that you might come across may be potential employers, potential colleagues, so you want to put your best foot forward and then have balance. Make good use of positive and negative space. So your positive space is where you actually put your words and your figures. You want to make sure it's not too much clutter. In the negative space, you do not want to have too much blank area on your particular poster. You want to make sure you fill it up properly in a way that is neat and is visually pleasing to the eyes. Some things you shouldn't do. Don't overcrowd your slides. If you put too much information on the slide, it'll be extremely busy, and a lot of people will look at it and blink, and it'll be a complete turn off. Don't use too many colors. Use a very small color palette. I know my slides right now are pretty colorful, but there's only a few colors on this particular slides or any other slides that I have. If you use a vast amount of colors, it might be a little bit too busy. And also, there are people who may be sensitive to too many colors, and they will just wouldn't even pay attention to your work. And that's something that you actually put a lot of time and effort into. And we do want to make sure that everyone reads and engages with your research. Don't ignore your layout. A clean and organized design is extremely vital. So everything should be in the right place in a neat format in ways that is very pleasing, and it follows a coherent pattern or a story. You should be able to tell a story from left to right. And if you go down the column, go from the left hand side, go down to the column, go to the middle, and go to the right hand side, and everything should flow very nicely. Another important thing is some people they forget their contact information. If someone is interested in your work and they're unable to spend the time to talk with you, they might just snap a picture or just ask for your business card or oftentimes, like the best way to do it now is put a QR code with your contact information in the lower corner, so someone can open up your if you have an electronic business card or connect to your LinkedIn page or any other type of virtual business card you may have. That might be the quickest way for someone to contact you. Those people are out there. I can't say from experience that I've had presented a poster at a conference. It was one of our state public health, or excuse me, pharmaceutical organizations. And the person who saw my poster that I didn't know at the time is now my the director of the pharmacy in which I worked. So I ended up interviewing with her a few months later after I presented, and I was actually hired on by this person. And she mentioned that she saw my work at this conference and was impressed. So it does happen, and I don't want to just kind of say things aren't a true story. I think my slides disappeared. I did not know where they went. Give me 1 second. Okay, looks like they're back. I don't know what happened. Okay. Is everyone still able to see my slides?
Yes.
Okay, thank you so much. Yeah, just blinked away from me. Got a little bit nervous. All right. Okay, so as far as the design, size wise, you want to check the required size of the poster and the orientation. Oftentimes, this is dictated by the organization that's hosting the poster presentation. After your poster gets accepted, they will let you know the space in which you are going to pin your poster, and they will also tell you which area of the particular hall or room or venue you'll be placing your poster. But most scientific posters are on average or 3 feet tall and 4 feet wide. That's a good size to stick to. You can go larger if the organization will allow it and you have that much research that you want to put on it. But I would stick with something that's 3 feet tall by 4 feet wide. just to be on the safe side because it fits in the majority of places. You'll go to these conferences and you'll see some extremely large ones. Just make sure that you follow the rules of the organization that's hosting because you'll need to know what space you're going to pin your poster to. In order to design a poster, the easiest way to do it is with Microsoft PowerPoint. You can also do it in Google Slides. Canva may even have some options, and there maybe other options out there that I'm not even thinking of. I've always gone with PowerPoint because I've been doing it for a while, and it's easiest for me to use. But the thing is, getting used to zooming in very closely in PowerPoint and working with that particular format up close. It takes a little bit of getting used to, but it definitely can be done. But there's some things that you want to make sure that you do prior to printing that poster. One of the things is, as far as the content is concerned, make sure you have the logo of your organization. Most institutions that you're representing will require it on all your presented work. So they want to make sure that everybody out there knows who is putting on this exciting research, who sponsored this exciting research, or what member is this person, what student is going out there and showing their best foot forward and representing us. You want to have contact any advisor or preceptor if you don't know where to find the logo. They're out there. Many schools. I haven't seen one that doesn't have a approved set of logos, pictures, or templates even for poster presentations or even regular seminars that you may host. So you definitely want to make sure you pay attention to that because it's extremely helpful. Your title, make your title as short as possible and attention grabbing. Oftentimes, you'll see colons in the title to break up two, related points. But this is where you want to do something that grabs someone's attention. The title should give a hint into your findings or a hint into your research or how your research is conducted. One of the things you don't want to do is use slang or even technical jargon. You want to be able to explain that particular jargon or explain those acronyms or explain your research to someone. You want it to be so grabbing that someone comes up to you and say, "Hey, tell me about your research. What exactly does this mean? What exactly did you find?" And that's when you just go into your pitch. It should become, after a while, you practice it, it will become natural to you. Trust me. And then we have the authors and affiliations. You, as a presenter or whomever is presenting, should be listed first. Then all your preceptors and everyone, your research colleagues that you worked with, will come afterwards. Now, if everyone is at the same institution, you can put one superscript, letter number one for every single person behind there, and then put your organization down at the bottom with a superscript. If you're working with people from several different organizations, they should be a list of organizations, each with a different superscript, and the person's name should have the number that corresponds to the organization with which they work. And I will show you an example of what I'm talking about. So here is a typical poster title. I'm pretty sure many of you may have seen these, but if you haven't before, this is what a title section is typically right smack dab in the middle of the poster or along the top. You will have the logos typically on the left-hand side. Sometimes you'll be with multiple institutions and there's a logo on both sides. Both ways are absolutely correct. You can also put them both on the same side. There's really no wrong answer. But for balance, you want to have a bit of symmetry. Now, your wall make poster will have a nice title. So this one's called a wall make poster can take your project to the next level, an instructional guide. So this is pretty much what I'm hoping to do today. So you have your name. You're not undergraduates. It should say pharmacy schools, and then have graduate students and other people and a faculty member. Oftentimes, the most important person that help you with your work is the last author or the last name that's up there, because the last person typically is like that cast member that you couldn't have done without. So it's typically that star that you want to speak of. And if you notice here, let me annotate real quickly. And this is what I mean by the superscript numbers. So in this particular example, every single person is part of this organization. If you have multiple organizations, you would have a two here, and your second organization or a three, so on and so forth. So I've been talking for a little bit, so I'm gonna stop for a second and ask: Are there any questions, or what questions would you have for me so far? Okay, if
Uh,
everyone is, I'll say
I
yeah,
have a
sure, sure.
question.
Hmm.
In regards to what you just mentioned regarding the different authors um, listed and the institution superscripts, let's say there's two different places, hospitals or schools. Can the superscripts be described or defined in the reference sheet instead?
No,
Or
they typically the organizations would typically be right up front underneath the names of the authors and the corresponding researchers.
all right, thank you.
You're welcome. So as far as the reference is concerned, they would have their own the similar type of style where in the body of your poster you would have your superscripts for typically you would see them in the introduction background section, and then you would have your smaller box for the references down below somewhere near the bottom of the your poster itself. But for this one, like the title, you want to have everything in that box up top, and then you want to see who did the poster, who helped the person do the poster, and like or the presenter, and where they are affiliated, right at the top, so they don't have to look too far for it. That's a good question. Thank you. Okay, if there aren't any questions, I'm going to move on after I close the annotations. All right, there we go. So moving on with more poster design, as I mentioned before, you want to keep your color palette simple, and then you want to avoid those neon, harsh or strongly contrasting colors. So you don't want to have a poster where you have red fonts on a yellow background. This may be visually displeasing, and also it may be very, very hard to read. As far as images are concerned, I am a huge proponent of images. I like to put my images right in the middle, like the most important chart or figure that I can come up with for my research. I'll put a smack dab in the middle of the poster. If your poster doesn't, your research doesn't lend to that type of graphic, use a table or something that breaks up just having a lot of words on your particular poster. You want people to be able to look at your poster within a minute or two and glean some of the information or a good grasp of the information that may either allow them to take away what you're trying to say or allow them to ask questions for you to clarify. Similar to your abstract, you'll see that the poster sections are very, very similar. You're going to have your introduction and your background, your methodology, your results, and your conclusions. As I mentioned before, your references, and also your acknowledgments. This is where you thank those who helped you. Oftentimes, it's your faculty, peers, managers, and disclosures if required. NPhA does require disclosures, so if you receive financial compensation for your research, it is not that does not prevent you from being able to present a poster, but we would like to know that this poster was actually sponsored by an organization or a company, so we are able to keep things above board, and everyone knows, that this research was funded. Font sizes. So this is what we talked about before. Typical size fonts. Depending on your size of poster and how much you're putting on there, it could go up or down. But oftentimes your title is going to be at an 85 point font. The author's names that go directly underneath will be 56 points. All subheadings will be around 36 points. The body of the text is 24 points. And the 24 point, that is the smallest size font that can be read at a distance from 5 feet away easily. So that answers a question that I had in the beginning. It's a 24 point font. If you want to get a little smaller, smaller poster, and people are going to be a little bit 3 feet away, a 20 point font is good for 3 feet away. But most posters that are on a 3 foot tall by 4 foot wide size, a 24 point font in the body of the text is the appropriate size. All captions will be 18 points. So if you have figures and you label a figure, figure one, picture one, chart one, chart two, whatever, those type of captions will be an 18 point. You want to avoid using more than one, or I would say more than one, but sometimes two or three different fonts on one poster. It gets a little bit too busy, and depending on the size of the poster, it'll look quite messy when it gets expanded to a larger size. It may look good on a smaller screen, but you got to remember, 3 feet by 4 feet is a pretty sizable poster. You want to stick with some of the basics like Times New Roman or Georgic, or sans serif, Arial, or um, Helvetica, excuse me, font, and go away from those cartoony ones like Comic Sans or Joker or something like that, because it's just like, it might not be deemed professional, and it also may be hard to read. And another point of that is, depending on where you have your poster printed, their machinery might not be able to print a large range of fonts. So it's also helpful to go with something like, they're the older, a little bit more boring ones, but it will ensure that you won't have any issues getting your poster printed at any one of these printing companies. FedEx, Kinko's, Staples is no different. So I'm going to take some time. I'm going to show you two examples of posters, and if you're able to, please jump in and let's have a bit of a critique so you kind of understand what I'm talking about when I say that this is a decent poster and this is a not so good poster. Oh, so let's look at this one. We have this poster, it's called The Effect of Zero Gravity and Ad libitum Feeding on Weight Gain in Cavia porcellus. Now, what are some of the things, based on what we just discussed in the past few minutes, what do you notice about this particular poster? You can put it in the chat, or you can just feel free to speak up. We should all be friends and family here.
Probably the distracting dark background.
Yeah, the background is very, very distracting. You might even look at it like see the galaxy before you even see the words. We have Daisy. She put in the chat. The font is too small. Yes, that's another one. That's a very, very small font.
It's too
Uh,
bulky.
yeah, it is way too bulky. Ichioma, hopefully I'm saying your name correctly. It's too busy and the background is distracting. Yes, it definitely is. There's another thing that I was saying. Yeah, the font is blending. Yeah, the font and the color are huge problems. It's extremely crowded. Yeah. Some of the other things I noticed is that there are too many words. There are, graphics and pictures, multiple color schemes, exactly. Graphics and pictures that don't make sense. I really don't understand what I'm looking at. I don't know if that's a hamster in the lower left-hand corner on the scale or what. What does it have to do? If Cavia porcellus is a hamster, I'm not sure. I didn't look into that. But yeah, there's a lot of it doesn't make sense. The boxes are scattered all over the place. It's not it's not done neatly, and I would say it's a little bit too cluttered, like we all said, and extremely distracting. There are a lot of different ways that this could be fixed, and one of the things is I didn't mention before is if you're going to use a box that has a lot of text, shorten the sentences and break it up using bullets. That's a very helpful way to do it. Get your ideas across. You want to make points, and you want people to read your bullets and be able to ask questions about what those bullets mean. And that's where you get that dialogue, and you also get that practice. You'll come to find out, and as you're doing this research and preparing your posters and discussing with other people, that you begin to know your research backwards and front. And oftentimes, you might not even have to look back at your poster to be able to answer those questions. And that's where we want to get you to, and that's how you move into the next level of presenting. So let's look at another one. Yes, asymmetrical, definitely. Everything on that chart and that poster was distracting and a clutter. It looked like everything was just dropped out of a building, and it ended up falling on the poster in some random organization. I don't know many people. Hopefully, you won't have a mentor or a faculty preceptor that would allow you to present something like that. I'm pretty sure you won't. So just save them the headache and save yourself the embarrassment. Don't even uh, you know, bring something like that to them in the first place. So let's go on to this next one. Now, this one I can say is a bit neater. Would you agree? But there are some things that you can take away from this that will improve this greatly. What would you say that is? You guys still with me?
With you, I just feel like this poster is my level of poster presentation skills.
Hmm.
So
Okay. No, I'm saying it's not a bad poster. It's not, but there's always some things that have changed. So yeah, there's no background section. So it says objectives and methods. You're not really sure exactly what you're looking at in that box. You don't want to leave it to someone to interpret. Okay, we have the objectives and methods together, but you don't want to have someone to read your poster try to figure out which ones are your objectives and which ones are your methods. So it's just having, strongly defined sections. I do like the organization of this particular poster. They are using graphics nicely, but I feel like there can be a little bit more done to explain some of the charts and figures. Yeah, and the title could use some work. Genomic data distinguish phenotypically distinct birds despite low levels of divergence. It could be a little bit more attention grabbing. And then with the title, they could do more of a better, I would say, a better job in explaining, um, you know, the background. Why are they doing this particular work? What made them, look into this? I understand it's a lab of ornithology where they would study birds, but what is the purpose? Why are the red shafted flicker, yellow shafted flicker important for them to be able to study? Also, the results in discussion section. Um, they have the results looks like below the discussion. It doesn't really follow in a very coherent manner, but that's not to say that this poster, like I mentioned before, is terrible. Just a little bit of tweaking would take it to the next level. You definitely want to make sure someone is able to look at it and come away with all the information that you want them to gather from your research without having to say too much. Because if you are oftentimes talking to someone else, another person might not have the time to stop and wait for you to finish, especially if the person with which you're talking at the time is quote unquote long-winded, which can happen. You'll see some people are just very, very interested in what you're doing, and then they'll talk for a very, very long time. Yeah, I would agree, Scott. Yeah, the graphics are very, very well organized. As far as the graphics, I would keep it that way, and I would use those graphics, but I would make sure that I organize everything else around it to make sure that people understand what they're looking at. The color scheme can go too. I say with the if they have these particular diagrams, it kind of fits. But for some people who are maybe you always got to think about those who may be colorblind or visually impaired. So oftentimes something that's closer to those primary colors might be a little bit a better way to go. All right, that was great. So let's move on to one of the last parts. So now you have designed your poster. You have printed your poster out, and it's presentation day. As you're getting ready, you want to rehearse. Prepare a 3 to 5 minute elevator pitch. Practice your pitch in front of yourself, in front of the mirror, or if you have a computer in front of your computer multiple times. Enlist your preceptor, faculty member, research colleagues to help you. They might be able to give you pointers or should be able to give you pointers on things you may want to increase or include or leave out of your particular speech. So getting feedback is a very, very important thing. Ask around, ask for help, and I'm pretty sure you will have someone out there who's very interested in what you're doing and is willing to help you. Well, I hope that's the case for everyone. Now you're standing at the poster. So you are in Cincinnati, Ohio at the NPhA annual convention. We want you to be approachable and ready to discuss your research. So engage with those who are in the room. Be able to explain clearly and concisely what your work means and its impact on either clinical practice or if you have a type of research where you're showing a differences in particular therapies or if you have some novel way of doing things as far as the pharmaceutical practice. We want you to be able to express that to the point where those around you and those who actually have the ability to make decisions are interested in your work and is willing to listen to more at some other point. Be willing to answer those questions. Try to look at your poster and anticipate what question can be possibly asked based off of what you have on your poster. Oftentimes, there are people who just might stump you. Do not be afraid to say, "May I have your contact information? I would really like to get back to you once I look into that a little bit more." Don't be afraid to do that. It's better than either floundering or making something up, because you'll seem like you're disingenuous or potentially a fraud at that time. So be as honest as possible and never be afraid to say, "Hey, I'm not sure of that, but I will look into it and I will get back to you. Would you mind just leaving your contact information with me?" But most importantly, especially if you go to NPhA or any other conference, but NPhA, make sure you enjoy your experience. We want you to have a good time. It is a very good learning experience. You are in a room with your peers nationwide. These are your colleagues. These are the people who are like-minded individuals, even though they might be in a different area of pharmacy. We are all in it for the purpose of the betterment of human health and human well-being. So, live up that day, have a good time, and just feel free. So don't feel too much burdened by the experience. So to wrap things up, preparing your poster can provide an entire wealth of opportunities. Like I mentioned before, you'll never know who is in that room evaluating you or looking for that next researcher or that next pharmacist that they can hire on to their organization. In order to get to that poster presentation, you want to make sure that you follow the instructions provided by the host organization when you are submitting the abstract and designing your poster. Also, you want to make sure you give yourself enough time to proofread and print after designing. Another tip that I want to leave with you is that prior to sending that large poster to FedEx or Staples, print a smaller one. Look for those particular errors and see if there's anything that you have to fix prior to them making it very large. And also give yourself enough time to do this, because once they print it out, you want to make sure that they print it out properly, that the edges and the margins are cut to where they should be, because you might have them do it again. If they make a mistake and if it comes out funny, they will have to do it again without charging you a second time. And again, practice, present, and have fun on presentation day. So I ask this question one more time. Standing 5 feet away from a poster, what is the smallest font size that is the easiest to read? Yes, we want to go with that 24-point font. Exactly. And one of the reasons why I did this is to show you how easy it is to get into research. Now, if I were conducting research and I asked you one question at the beginning before I taught you anything, and then asked you at the end the exact same question, and I want to look at the differences and the answers in the beginning and the end, I would just do a student's t-test or a paired t-test to compare the results. It is really that easy to get into research and to work with data. It's something that we all can do, and I really want to encourage you to do this. So I would say that is it for me. I would thank you for your time tonight, and I really appreciate it. And before you go, what question would you have for me? Okay, Jamie.
Hi. I had two questions.
Sure.
My first one was on the abstract form.
Mhm.
It has March 15th as the deadline.
Yes. Based on the feedback from your SNAFA national president, there was something that I wasn't aware of to begin with, and we pushed the deadline back to May 1st. So it is going to be May 1st for both established pharmacists and for student pharmacists as well.
Oh, that's perfect. Okay.
Mhm.
My second question. I know that it's two types that you can present, a research or the clinical project.
Yes.
Is there a very big difference in the two as far as poster format?
Yeah, like your results for the clinical research will most likely be quantitative or qualitative. So there'll be a lot of in the results there'll be numbers, facts, and figures. But typically, if you're showing an improvement process, or there's some type of new way of therapy or new practice or something that you're proposing, it might not have a results section.
Okay.
So you can
Okay.
talk about how you are doing this new thing. So if you have a new way of doing medication therapy management that you found that works, this is where you want to show that information and show exactly how it's conducted. Because there may be people interested in, bringing that to their organization. So you wouldn't exactly have a results, but if you have a little bit of research behind it, or satisfaction scores or things like that, you will put that in there as well. But you might not have those hard and fast results as far as numbers or percentages or proportions or anything like that.
Okay. Thank you so much.
You're welcome.
Okay. One half last question. So
Sure.
when you said that if I had like numbers to back up, let's say a project that I wanted to implement, is it appropriate? I know you said don't add things that are like, over explanatory.
Hmm.
Would it be appropriate to add like maybe a line in like support in the background of like, 25% of the population, da 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 da. Like, is that appropriate, or just leave it out?
No, that is appropriate if it's pertinent to the success, or if it's something that you're showing has is directly related to the work that you've done. So if you saw a 25% improvement in hypertension scores based off your new practice,
Okay.
you definitely want to put that information out there, because it's something like, say, hey, in a month we saw, our average, systolic blood pressure decrease in, by 25% in all of our participants. So that's something that's extremely important to show. You can put that into your discussion section, or if you have more figures like that, I will put that in the results section as well, or just make a results
Okay.
section for it.
Thank you so much.
You're welcome. So if there aren't any other questions before we all go, don't hop off just yet. I want to show you a timeline of what's coming next. NPhA has a lot going on, and we want you all to be part of it and sit with us. So our first event, if you are in the Washington, D.C. area, the NPhA will be at the Black Health Connect Mixer. That's held in Washington, D.C., and that's this Friday, February 28th. On March 12th, research seminar number 2. I hope you all will return, or tell your friends to come in, because that's where I will show you all where we can get data. Let's see, Jamie, do you still have a question? Oh, okay, sorry about that. So yeah, on March 12th is I'll be showing you exactly how and where to get good data to do research. So if you are interested in getting research and you're not sure exactly where to find the data, or if you're unable to align yourself with a hospital or health system or a clinic, there's data out there that you can use in order to put research together. It just takes a little bit of time and some collaboration, and I'm almost positive that there's someone where you are that is very, very well versed in statistics and research that would be interested to help you if they have the time. On March 19th, I will go over some ways in which you can put that data together for a poster. So I'll go over some study research design methodology, a little bit of biostatistics and epidemiology if you're not familiar with this, but it could be a good review session for those who are well versed in it. On the 23rd of March, yes, thank you, Scott. We have the Zone 1 and 2 conference that's in Philadelphia on March 7th and 8th. I apologize for not having that. That should be the next one after February 28th. So those are NPhA SNAFA members that are in Zone 1 and 2. The annual conference, or the regional conference, will be in Philadelphia, Pennsylvania on March 7th and 8th. Later on in March, NPhA will have NPhA and SNAFA, will have a network reception at the APHA conference. If I believe it's in Nashville, Tennessee. So if you are down there, make sure you first you want to look at our website, and I believe you would have to register for that. Dr. Lucas, if you could chime in if I'm correct on that. So you will have space in that reception for you. And then March 31st, we have the ASCP, NPhA, AAPP, and ASBA. We'll have a congressional fly-in also in Washington, D.C. So there it will be a lot of networking, politicking, and lobbying opportunities that is available that. And then as I mentioned, May 1st, we have the poster presentation abstract submission deadline. So we're going to fix the dates on the NPhA website that currently says March 15th. But if you know someone or if you are interested, please remember that it is going to be on May 1st of 2025. That's when the abstract submission portal closes. Before I wrap up, I want to say thank you so much for joining me tonight and spending your time. And I do hope to see you all on March 12th. And also, I want to see you all at the NPhA national conference in Cincinnati, Ohio, this coming August. So thank you so much. Have a great night. And I'll put my email address in the chat if you'd like to message me. Feel free to do so. I like to run my mouth. Trust me.